Because I grew up in the Philippines, and most of the education and most of the everything is like Americanized. So even the terms we use are Americanized. But when I went to Australia, completely the opposite. Let's start with the time. Here, you don't say 2 o'clock in the afternoon, but you say 1400 or 1600. That's how you go and use in your documentation as a nurse. That's one of them. And some terms like a rubber, meaning to say they want an eraser, or there's so many terminologies that is really different. And in terms of medical terms, it's also different. Like yeah, you say COPD, congestive, obstructive. Chronic obstructive, pulmonary disease. But here you call it chronic airway. So it's different, and there are things that sometimes you can go and assert yourself to talking to your doctor. We don't have respiratory people to help us. We do our own dialysis. Unlike in America, there's someone who helps you to do the dialysis. Here, we do it ourselves. When you do your ventilator, there's what you call the respiratory people who comes to drain your tubes or everything. But here, the nurses is the one who's doing it. And there's so many independent nursing not independent nurse, and there's so many procedures that being done by the nurse and not with the other allied health workers. Yeah, it's more too much work actually. So I'm really shocked about that one, because I didn't know there's so many things you need to do. And culture shock in the sense also with the multicultural people that you have to deal with. Like if it's a Muslim, you don't have to sponge bath the patient without the wife. Or if in religion, you have to consider about the blood transfusion. So there's so many, and how you talk, or how there are some cultures that women has to go and ask permission, something like that. This is being taught when I started doing my nursing in Australia. We were briefed for that one. So yeah, but I got adjusted.